So when we think about the JAMS protocol, which stands for Jaw, Joint, and Muscle Sprain and Strain, there are two really important pieces of this. One piece is the assessment piece, that we can use this information in this protocol to assess our patients and figure out on the front end whether we would put them in a low, moderate, or high risk category for developing jaw, joint, and muscle sprain or strain. And that then allows us to go through a series of protocols to prevent that from happening, so that as we move into actual restorative appointments with our patient, we know the risk that they present, we know the risk of a particular procedure, we can put that information together and we can follow a series of things to make sure that we keep the patient as comfortable as possible and that we prevent the possibility of them having a post-op complication that involves their jaw joints or their muscles. Now, the second piece of the JAMS protocol is evaluating a patient who's already experiencing jaw joint and muscle sprain and strain. And what we want to do is we want to use those same criteria, the same assessment, the same questions, and we want to very efficiently be able to help that patient, treat that patient as soon as there's any evidence that they have jaw joint or muscle sprain and strain, so we can get that resolved quickly and effectively. And our goal being that we want to avoid the patient having a more complex, chronic, or long-term TMD issue as a result of a dental procedure. Well, Jenna, one of the things we want to do today is we'd like to get some information about your joints, your muscles, what's going on with the function of how your teeth function together. And part of that will be to help us assess whether you have some risk factors in that area, just like we look at your gums and your teeth.
Okay.
So to do that, I'm actually going to use an assessment, and I'm going to just kind of follow the questions, but you and I can have a conversation about it as well.
Okay.
So first thing right off the top is just to find out whether you're aware of any pain in your jaw joints or in your face, either now or in the past.
I am currently and in the past have had pain.
Okay, so can you tell me a little bit more about that? What have you been experiencing?
I've been having recurring pain in my left and right jaw, and it causes headaches in my temple region, and it is uncomfortable to open too wide, and it just is a problem throughout most days.
Okay, well, you actually hit a couple of my questions, so we're going to go back and get a little more detail.
Okay.
So you said you have pain in your jaw joints on both sides. Can you actually show me where that hurts?
Around in this vicinity, in here, all in these regions.
Okay. Does it always stay in the same place, or does it move around?
Always stays in the same place.
Okay. And you said now and in the past. More specifically, for how long have you been experiencing this?
Probably the last 3 years, 2-3 years.
Okay. And has it stayed consistently the same through that 2 or 3 years, or has it gotten worse and better? Does it come and go?
It's stayed mostly consistent, but in the last year it's probably begun to get worse.
It has begun to get worse. Okay. And you mentioned having frequent headaches and having pain sort of appear in your temples. How often would you say you have a headache?
Daily or every other day.
Okay, so all the time. And what are you currently doing to manage that?
Advil or Aleve.
Okay. And does that work? Does it actually get rid of the headaches?
Yes, for a time.
Okay, so a time being just a couple of hours until the medication wears off?
Yes.
Gotcha. All right. Anything else that you're doing currently to manage any of this?
Yes, I wear an appliance.
You do? Okay, so how long have you actually been wearing an appliance?
For the past couple of months.
And have you noticed some improvement with that? Does it help?
Some slight improvement day to day.
Okay. And are you pretty good about wearing it?
Yes.
Okay. So when you say day to day, does that kind of mean things are different every day? It's not always exactly the same? Do you have days that are worse or days that are better?
Yes, some days are definitely worse than others, and most days it kind of stays at a medium point. It isn't too good or too bad, but
Gotcha.
There are definitely bad days.
Okay. And have you noticed anything that contributes to those bad days?
If I've had a stressful day, if I have a lot of schoolwork, or if I'm really tired, and those couple of things.
Okay, so there is some correlation to some other things that are going on. Okay, so you also mentioned, I think, when we first started talking about the fact that you feel like it keeps you from opening your mouth too wide. Can you tell me a little bit more about that?
Yes, I just find during hygiene visits, it's hard for me to open all the way, or when I eat, sometimes it can be challenging to chew because I want to stay in a comfort zone.
Gotcha. So if I asked you to open really wide, could you for me?
I could, but it would become uncomfortable at a certain point.
Okay, so it would be uncomfortable. So when you say you don't open very wide, you're doing that kind of with thought to keep it from being uncomfortable. Yes. Okay. Does that ever have you think about the foods that you eat? Do you purposely avoid things that are sticky or chewy or super crunchy like nuts or hard foods?
Not most of the time, but something like an apple might be challenging because it's so firm and you do have to open your mouth fairly wide.
Gotcha. So like to bite into an apple.
Yes.
Okay, I gotcha. Okay, that makes sense. But actually chewing the apple
is fine.
You would be fine. Okay. All right. Well, you mentioned hygiene visits. So I am really curious, do you notice that your symptoms get worse after you have a dental visit?
Yes, probably for the first couple hours after.
Okay. And do you just treat that also with just like some Advil or anything?
Yes.
Okay, and that helps. What else? Anything else that you try to do or you talk with us about around your dental visits that could help make you more comfortable?
Maybe to bring my appliance so that I can wear it immediately after, or to take breaks throughout the appointment and let my jaw rest.
Okay, so that actually helps if we give you
Yes.
a few minutes. Okay, and I'm going to guess it also helps if we don't keep asking you to open your mouth as wide as possible.
Yes, that definitely
okay,
helps.
Awesome. All right. So I know you mentioned, you actually showed me before kind of some places where you have some discomfort. Do you actually ever like press on those and like can you identify sore spots?
Yes, I can.
Okay, and so you're really familiar with sort of where those muscles
Yes.
are hurting. Okay. Is it just up here in your head and neck, or do you also have any other body aches or sore spots and muscles on any of the rest of your body?
I have more muscle aches and sore spots.
You do? Okay. So have you actually had that diagnosed by a physician?
I have fibromyalgia.
Okay. And what do you do to manage that?
Stretching, Advil, Aleve,
Okay.
those types of things.
Okay, so pretty much you're managing it on your own and really not on any specific prescription medications
That's
for
correct.
that. Okay, all right. I know you said you wear an appliance, and I'm curious, was that done because you think you clench or grind your teeth, or are you aware that you hold your teeth together at all during the day other than when you're chewing food?
Yes, I clench.
Okay, and are there things in your day, activities in your day that make that worse, or you become more aware of that?
Sleep or stress.
Okay, and how often are you wearing your appliance again? I think you said pretty routinely, right?
Pretty
Okay.
routinely.
All
Every
right.
night and then occasionally during the day.
Gotcha. Okay. So it sounds like this has been bothering you for a couple of years, and you do have some management strategies in place, which sounds good. I'm curious, though, if there's also a sort of an emotional impact to being uncomfortable like this. Does it make you kind of stressed or anxious, or do you ever get sort of kind of down about like, God, I wish I'd feel better?
Yes, definitely. A lot of stress and anxiety revolves around my jaw pain.
Okay. And are you doing anything specific to manage that?
No, not really. Not currently.
Okay. But if we could do something to help eliminate some of that pain, I'm guessing it would be
Yes,
it would be
that'd
a
great.
positive thing. Okay. On that same topic of talking about stress or anxiety, is there any additional stress or anxiety when you come to a dental visit, either because of dentistry, either just because of sitting in the chair, or because you are worried about how that's going to impact your joints or your muscles after you leave?
Yes, maybe a little of both.
Okay, so if we had some management strategies that we could talk about to try to help keep you comfortable after your appointments, is that something you'd be open to discussing with us?
Yes, that would be great.
Awesome. Okay, we can definitely do that. All right, well, that's kind of my list of questions on my assessment. Anything else that you're feeling right now would be important for me to know about this?
No, I don't think so. I think that covered it.
Okay. Well, one of the things that I would love to do, if that's something you're interested in, is get a little more information about what's actually going on with your joints, your muscles, and with your teeth, or what we call the functional piece on the tops of your teeth, so that we can actually look sort of at the anatomy of your jaw joints. We can actually find out with those muscles where some of those sore spots on, kind of what's contributing to that whole picture, because that information will really be important for you and I moving forward, both to help manage what's currently going on so we can get you comfortable, and to prevent any worsening of your symptoms, especially as we move forward if you need to have some other dental appointments. Is that something you'd be interested in doing?
Yes, very interested.
Awesome. All right. Well, we will figure out whether we're going to do that today, or we're going to have you come back for a separate appointment to get that information.
Okay, sounds good.
Awesome. So thanks to our assessment, I have a lot of really valuable information about Jenna relating to her joints, her muscles, and to her function. The very first thing I think about now that I have that information is I need more diagnostic information. So I want to be able to complete a joint, muscle, and functional exam for Jenna. If this assessment took place and Jenna was already on my schedule for a comprehensive exam and I had the time to gather that next step diagnostic information, I would proceed and do that today along with the other parts of her comp exam, which might be around her perio or what's going on with her teeth. It's also very possible that we got this information from Jenna during a hygiene visit as a new patient. I still need to move into the phase of getting the diagnostics about her joints and her muscles and her function. And for me, I would actually invite Jenna to come back and we would actually schedule a second appointment. And then she and I would spend the time together to get that information before we moved forward into doing any definitive dentistry for Jenna. We need to manage what's currently going on. She's currently symptomatic. We would put her in our high risk category, and we do discuss how do we put a patient in low, moderate, or high risk in a separate video. And for Jenna being in high risk category, we definitely need to manage what's already going on before we do any definitive dentistry for her. Let's think about this from a different way. It's also very possible that this information could have been gathered for Jenna after a restorative appointment. So instead of her answers being, my joints have been hurting or making noise for several years, she might be telling me, those things just started after I just had that scaling and root planing appointment, or after I just had my wisdom teeth out, or after I just had that crown and bridge appointment. And again, I'm going to need to move into the diagnostic phase. I'm going to need to gather some diagnostic information, and I'm then going to move into a management phase. So this assessment is really useful both at the front end, before a patient is having a procedure done in my office to understand their risk, as well as after a procedure, because now the patient has called my office and they're actually having some of these challenges. So when I think about this assessment, I go all the way back to thinking about being set up for avoiding jams in our practice. And these questions can also be asked on a phone. So the ladies in my office who answer the phone can ask some of these same questions were Jenna to call in the day after I did a crown, and they can start gathering some of this information. So using an assessment is one of our primary tools when we think about working with our patients in our office to either avoid or to manage joint or muscle sprain and strain.